Thank you everyone for being here today. My name is Christine Alvarado and I'm the Director of Swim Lessons here at the Rose Bowl Aquatics Center. I've been working here for a little over 14 years and I just could not be more passionate about teaching children how to swim and the importance of learning how to swim. And I get asked all the time, why is learning how to swim so important? Well, the easiest answer, and I hope the most obvious, is that it's a life-saving skill. Once somebody learns how to swim, it has the potential to save their life. So if you have the option to learn how to do something that has an impact that could one day mean life or death, it makes it pretty important. Now, once somebody knows how to swim, it's something that they'll carry with them for the rest of their lives. Learning how to swim allows you to participate in one of the healthiest forms of exercise that there is. So it's really important to kind of get that ground and just, make sure that you learn how to swim. And from my perspective, learning how to swim is something that should definitely be enjoyable. It's something that you should have a good time while doing. That way you kind of instill that lifelong love for the water. And there's a lot of residual effects to learning how to swim, but one of them is just kind of having the pool as a sanctuary, a place to go to, an outlet for exercise, to relieve stress. It's, like I said, one of the best forms of exercise that I believe that there is. And a lot of times when we work with these kids that are really little, it helps with other aspects of their life. It helps with confidence. It helps with them feeling comfortable. So it's just something that's really important. And, as we kind of enter this time where pools aren't necessarily going to be open the same way that they have in the past, I just want everyone to exercise caution, to make sure that they're having those important conversations with their children about staying away from bodies of water that, are unsupervised. And we can still cool off if it gets hot out there with other activities. There's still slip and slide, there's still hoses, there's other means to kind of make sure that you're cooling off, but making sure that you're staying safe. So if at all possible, always try to enter a body of water that has supervision. But if it isn't, this summer, please just exercise caution and try to do other activities.
It's probably the #2 cause of death for children under the age of 5. Might be one of the top 3 causes of death for teenagers. It's a real severe problem. And in fact, just a year ago, an Olympic champion had his daughter fall in the pool and drown. And yesterday is the 1-year anniversary of a Pasadena child who passed away due to drowning. To talk about it are the child's parents. Let me tell you their names: Doug Forbes, F-O-R-B-E-S, and Elena Matyas, M-A-T-Y-A-S, that's E-L-E-N-A, Elena Matyas, are here to talk about the Meow Meow Foundation, and we remember their daughter.
My name is Doug Forbes. This is Elena Matyas, my wife, and this is Charles Brown, a board member of Meow Meow Foundation, which is a 501c3 with a mission to eliminate preventable childhood drowning in California and to dramatically improve summer camp health and safety measures, since this state, California, does not require day camps to be licensed or otherwise regulated. Trust me when I tell you, there is no coming back from staring into the black, unresponsive eyes of a child who is drowned, especially when that child is your 6-year-old daughter. Roxy drowned a year ago, almost to the day, at her summer camp, while in the care of multiple adults. So as the summer kicks in and people have been cooped up and bottled up by this devastating virus, we adults should remember these critical facts. 9 of 10 child drowning cases occur with at least one adult present. Yet only 1% of adults list drowning as a home safety concern. If adults keep their eyes on their children near any body of water, including bathtubs and even toilets, we can eliminate the fact that drowning is the leading cause of injury death for kids under 4. So what we suggest is phones down. Take your eyes off your friends and focus them on children. You do not want to wake up like us every day, unable to hold the love of our lives in our arms. So Elena will talk more about this.
We are so very fortunate to have the Rose Bowl Aquatics Center right here in Pasadena and the wonderful services that they provide to our community. Christina spoke about the swimming lessons provided here, and it's such a wonderful opportunity for the children of Pasadena to learn how to swim, and adults. We cannot stress the importance that swim lessons are just one piece of the puzzle. The absolute essential preventative measure to be taken is adult supervision. Adults must always be aware when children have access to water, whether that's a swimming pool in the backyard, a bucket, a toilet, an inflatable pool with everybody cooped up at home with COVID. Other life-saving skills, such as CPR, are essential to ending this very preventable tragedy from occurring to anybody. I'll turn this over to Charles, who is a lifelong Pasadena resident, a former lifeguard, and a swimmer.
Thank you, Elena. Thank you, Doug. My name is Charles Brown. I am a lifelong resident of Pasadena. I spent many years swimming here at the Aquatic Center, and I can say that I'm humbled to be a part of the Meow Foundation and their partnership with the Rose Bowl. The work they're doing is of utmost importance, and the courage shown by Doug and Elena in the face of this unspeakable tragedy and their efforts to help prevent drowning for other children in the community, I think, has been beyond heroic. The work of the Meow Foundation and their water safety program and their drowning prevention program is an outstanding effort by people who have transformed tragedy into courage, and I think it's something that should be commended, and I'm humbled to be a part of this organization. Thank you.
I got involved with the Rose Bowl Aquatics Center about 14 some years ago, where both my children learned how to swim here. One of my children, my son, felt that frozen water is much better than a pool, and he is now playing ice hockey. My other daughter has started at age 4. She went through the age group. She's been on the national team for about 5 years, and she's going to be taking her swimming to Georgetown University. So the Rose Bowl Aquatic Center is truly part of my home, and Pasadena is where I grew up, and I remember this pool as well. So as was said before, the biggest concern is drowning. Drowning is one of the most common preventable causes of death in our children, and it can extend to adults as well, because there are a lot of adults who are not learning how to swim. So the importance of learning how to swim cannot be underemphasized. This day and age, as we're moving to July 4th and we are moving into the summer, it's going to be important that we follow our children very closely to reduce their risk. With the COVID, everyone wants to get out, everyone wants to be active, and as it's going to get hot, people are going to look at pools, oceans, and whatever venue in order to swim. So what is drowning? Drowning is the actual process where water gets into the lower airways of your lungs. Now when that happens, oxygen can't be transported from the lungs into the circulation, so you get a low oxygenation. What that causes is brain dysfunction. So another thing happens is the child or whoever is drowning begins to panic. And that's the worst thing, because more water will come into the lower airways, and that makes things worse. Over time, with low oxygenation, the brain can't work, and ultimately the heart stops working as well. This is the standard drowning that everybody is aware of. However, there's other types of drowning we must also be conscious for and look out for if someone has had an event where water gets into the regular airway. And this used to be called dry drowning. This is very much a misnomer because it's not dry, there's water getting into the lungs. And this happens in two different cases. Number one can be the case where water gets into the upper airway. Right around your voice box, we call it your larynx. The water can irritate the airway and you get laryngospasm. So you get a spasm of the upper airway so that air can't enter into it. This is very much like severe asthma. And this can happen even after the child has gotten out of the water. It can happen a half an hour or an hour after the event has occurred. And this leads to coughing, it leads to a hoarse voice, it leads to shortness of breath. You'll see shallow breathing, and then with lack of oxygen, the child can pass out and the heart can stop. This is something, again, that can last a half an hour to an hour after the event. So even though they're out of the water, we need to be very vigilant. Any signs of progressive coughing, trouble with the voice, or wheezing, we need to call 911 emergently because that airway can close at any time and we need to seek emergent support. The other one is even more dangerous. Over time, even a small amount of water can get into the lower airways. And that lower airways, this small amount of water may not cause a problem now, but it can take days and even up to a week for that water to cause inflammation. And when you get an inflammatory response, the fluid starts to build up inside the lungs. And when it does, just like in heart failure, and as we're seeing over the last several months, this is exactly what COVID-19 does, that inflammation doesn't allow the oxygen to get into the circulation. So patients are essentially drowning at this time, but it happened days to a week after this initial event. And a small amount of water can lead to this. So we want to be very attuned to monitoring for increasing cough, increasing shortness of breath lying down, panicking, and fatigue. Those should be taken into heavy consideration, especially if someone has had a critical event while in the pool. These are all types of drowning that we should be aware of and get to 911 or the hospital sooner. The last thing I want to mention is COVID-19. It's all over the place. We all know about it. We're so fortunate to have everybody back at the Rose Bowl Aquatics Center, but we want to be safe. And the Rose Bowl Aquatics Center has done a phenomenal job. I've talked with people here. They really have, for weeks, have really sat down and planned this out great. And as people get back into the summer mode and it's swimming, you want to look at facilities that have done the planning correctly. As you saw when you came in, they're checking for symptoms, they're checking temperatures. There's only certain people and social distancing that's involved the entire time. Once you're in the pool, people are worried, am I going to get COVID from swimming? The answer is absolutely not. The chlorine and the treatment of the pool makes COVID-19 non-viable almost immediately. So the water is a very safe place to be. And as an Olympian, everybody knows in lap swimming, as these people are today, as you're swimming, you exhale under the water. So the breathing, even above the water, exhaling underwater is not going to lead to a risk of COVID. However, we are in a social environment. So we need to be attuned to that and remember that even if you're standing in a pool and you're social gathering together, because COVID-19 is spread aerosolized from the air, from breathing or coughing or sneezing, you can still get COVID-19. So you want to be aware of social distancing while you're in the pool. We do not want you wearing masks while you're in the pool because the water getting on the mask can obstruct breathing. But when you're out of the pool, you want to wear your mask, you want to social distance, and you want to spread out. These are the things that are going to reduce your overall risk. Using those smart things out of the pool, but enjoying the swimming while you're there. Thank you.
Thank you, Dr. Giesler. And before you begin thinking that we think that adult supervision is overkill, it's not. Even at the Olympic swim team trials, lifeguards with the lifesaver buoys are supervising and watching the athletes who compete. So it is no joke. This is a serious thing for us. Next up is Erica Frausto, E-R-I-C-A, F-R-A-U-S-T-O. She's the executive director of the San Gabriel and Pomona chapter of the American Red Cross. Erica, join us. We love your color red here at the Rose Bowl Aquatics Center.
Thank you for having me. As we heard today, there are water dangers everywhere, from home pools to rivers, streams, and even in our own bathtubs. The American Red Cross believes that together we can work to improve water competency. Oh, there we go. Can we hear me? Okay. The American Red Cross believes that together we can work to improve water competency. And what is that? That is swimming skills, water safety, and helping others. I encourage everyone to empower themselves, especially as temperatures get warmer. We want to be in the water to stay cool, but let's get empowered to be safe in the water, to keep our children and our weaker swimmers safe. I encourage everyone to visit the Red Cross website to learn more about our Red Cross training programs and our safety apps. Thank you.
Thank you, Erica. Before I introduce our final speaker, I do want to call to attention the fact that in our midst is the chairman of the Rose Bowl Aquatics Center, Pat Amsbury. Would you just wave a little bit? Nice to see you here. You keep coming down here. Whenever something goes on, you take the time to show up. Okay, our final speaker is Bryan Frieders. That's B-R-Y-A-N, Frieders, F-R-I-E-D-E-R-S, the interim fire chief for the Pasadena Fire Department, responding to reports about drowning and how to keep private bodies of water safe.
Thank you. It's heartening as a first responder to hear stories of parents and the victims of drowning. Drowning is the leading cause of death of children under the age of 4. And I think, as Dr. Giesler mentioned, it's a very preventable cause of death. As first responders, we see the triumph and tragedy in people's lives. But hearing these stories and how important it is to educate people and understand the importance of pool safety can't be overemphasized. For every death, there are 5 injuries that result from water injuries or from water issues. It's pretty common sense to think, use a pool fence. I recall responding to a drowning, and I remember distinctly the look of horror on the parents' faces as they watched the first responders care for their drowned child. That is an image I have in my head that wakes me up in the middle of the night at least once a month. Because I have 3 children of my own. I also have a pool that has a fence. When you're out there with your children and when you're out there near a pool, put your phone down. There is not an important enough phone call that you need to take that would subvert the importance of safety for your children. Pay attention. That's been said 3 times now. Pay attention when your kids are in the pool or any kind of body of water, whether it's a blow-up pool, a bucket of water, out back on a slip and slide. You have to pay attention to your children. If you don't have a pool fence around your pool at your home, you're asking for trouble. Learn CPR. We have the American Red Cross here. CPR is a very simple, easy thing to learn. My 7-year-old daughter is learning CPR. If she can learn CPR, you can learn CPR. Take the time to do it. It can make a tremendous difference in someone's life. I'm very happy to share the call that I'm referring to where I watched the horror in the parents' faces. That 3-year-old girl survived and walked out of the hospital a week later. She's a lucky one. Many people don't survive, and you can make a tremendous difference. Just because someone's had swim lessons doesn't mean they can swim. Just because someone's had swim lessons doesn't mean they're not going to drown. It is up to you to pay attention to what's going on when your child or an adult is in a body of water. That's your responsibility. Thank you.
Before we bring this program to a conclusion, I'd like to say thank you to the Dewey Pest Control Company. It's their financial support that allowed us to reopen in such a significant manner. By your show of hands, do any of you want to talk to any one of us afterwards? Otherwise, I'll release our speakers. If anybody wants to speak with any one of us, Okay, are there any other questions for me? Thank you for joining us for this very important announcement, and we appreciate your continued support.